Hey there! Did you know that this podcast has a supporters club? By becoming a supporter of the show, you can gain access to exclusive content and play an active role in helping the podcaster continue producing the content you love. See the link in the episode description for more details. Now, let's get back to the episode.
Welcome to the new Disruptors podcast. Here's your host, the wild man behind the mic, Bill. Hello, everybody. Welcome back to the Disruptors. This is going to be an exciting show today because we have a very special guest coming on the air. I had an opportunity to discuss medical insurance. Now, this is very important for families and for individuals because we all, every once in a while, need medical help. And to have good medical insurance is especially important as you grow older. Now, there's a lot of different plans. There's a lot of different areas of insurance that you might not know about or have never thought of. So what we're going to do today is we're going to talk to our good friend, Tony Albrecht, and he's going to tell us about the company he's with, and we're going to discuss over the phone some of the plans and some of the things that you really need to know as a consumer. So here starts the conversation as I asked Tony, where did he get the ground in the starting to be into the insurance industry? Now, here's that conversation.
Well, I'm partnering with an organization called the Medicare Exchange, located here in Tacoma, Washington. We have our Tacoma office and the Linwood office just north of Seattle.
Oh, so you have two actual outlets now.
We do. Yeah, we do.
Oh, okay. And give us just a little bit of a background about how you got into the business and where you started and why.
Oh, absolutely. So I've been working in the insurance industry since August of 2000. I kind of landed in this job because I needed a job. I had about 2 years before this, I had worked in newspapers. I was a reporter, worked with the News Tribune, the community paper in Kent, and the PI. That actually was my first job coming out of college. Graduated from Wazoo. Yeah, I worked for the state of Washington and the Department of Revenue PIO office. Wasn't a good fit for me. And like I said, I needed a job, and I got a call from a headhunter who said, hey, how would you like to come in and talk about this job that I have open? Looks like you'll be a good fit. And could not get her to tell me exactly what it was. And when she said it was to do insurance, I said no at first because I had just gone through a big battle with the state of Washington and their healthcare system because they were going to deny paying for the birth of my daughter like their insurance information said that it would. So I had gone through, read their insurance contract, found the pages that I need in the back of the book. So I probably should have started there, and sent in information about saying, if we did this, you would do that. And about 3 weeks later, I got a request or a response saying, yeah, you're right, we'll cover the birth. And that's how I ended up in insurance.
So you went in the back door of the insurance industry.
Right. Almost kind of a karma thing, if you will, But yeah, that's how I got in. And like I said, I started in customer service for third-party administrator. Very simply, that's an organization that large companies hire to administer the benefits to their employees. So I got a taste of everything from medical, the dental, the vision, life insurance, even working with employee stock purchase plans, 401ks. So I kind of got a taste of a lot of different things. So I did that for a short time, then got hired as an analyst to work for another organization in employee benefits. So it was not uncommon for me to have like 4 or 5 different medical plans in front of me, 3 or 4 dental, and et cetera. And then based upon my analysis of drawing out comparisons, uh, provide the information to the broker to work with the client and say, okay, this is what we think might be the best plan for you, or you stay put where you are. So it was a good training ground for me when I eventually moved over to Medicare in 2012, and that's where I've been working since, as kind of my own boss.
So you've been over there, shall we say, kind of running the show now that you understand insurance, and you kind of, I would say, got to be quite a part of the interest of how the insurance plans operate, what's going on.
Yeah, I think so. I could say that.
Yeah. What? Let's just take a look at the insurance industry real quickly. In your view, there's been a lot of, shall we say, water under the bridge with changing of insurance policies and different ideologies of what a good policy is worth, how it can protect you and the family and your needs, how complicated they're getting. Can you give us kind of an idea, if we were a first-time insurance buyer, what will we be looking for in an insurance policy for medical insurance?
I think if you're a first-timer, obviously the one thing we worry about is paying too much or, not having enough coverage. I think that there's a few things you have to look at. Thing number one is, what's my lifestyle? What's my health? And then I think secondly, if you're already seeing doctors or medical networks or clinics or whatever, you definitely want to make sure that they are, that they're covered under whatever plan you're looking at. And also to medicines, if you're taking any. A lot of the young folks who are just entering, the market don't necessarily have to worry about that. But older folks do, So I would say that those would be like the big things you want to look at. When you're younger, you don't have to pay as much because you're not going to the doctor all that often. Then as you get older, things change. We get, these phantom aches and pains, and we got to make sure, that we have the proper coverage. So I would say that those are the things you want to consider when you're looking at it. Oh, deductibles, co-insurance amounts, max out-of-pockets. We can go into more detail about that stuff. But in addition to the premium that you're going to pay, you also have to worry about or think about how much it would cost you to actually use the plan as well. If you have a plan that's cheaper premium on the front end, it may cost you more on the back end, meaning that you may have higher deductibles, max out-of-pocket amounts. And then paying more on the front end, you may pay less, when you actually use the plan, like smaller copays. The plans may cover more, but at the same time, those really nice, expensive plans may not necessarily be the best. So it's best to just really sit down and just make sure that you really take into account everything you're going through and that you're dealing with. Yeah.
There's so many different plans. Let's just take a look at, first of all, what is the dual coverage health plan? You see that on social media being advertised all the time. What does that break down as?
Okay, so that more of a Medicare Medicaid plan because it's dual coverage. Anybody qualifying for that, basically they have a lower income range. And those plans, depending on your level of Medicaid, that will determine whether or not the plan and Medicaid will basically cover your out-of-pocket costs for your medical services. One of the hooks that you see on TV with this type of plan is they talk about all the other extra benefits that they offer, the ability to help pay for food and cover all these extra services like vision, dental, and hearing. And of course, everybody wants that sort of thing. But now with dollars shrinking up, Medicaid, it's supported from federal money, but it's administered by the states, those dollars are not coming in quite as abundantly as they were in the past. And so now they're lowering the amounts of income that you are would be eligible to get full coverage on those. And a lot of those plans now are requiring you to have like certain health or chronic conditions before they will give you a lot of those extra benefits. When you see it advertised on TV, it's a hook. They don't tell you specifically that you are or are not eligible. So they want you to call in to their 1-800 lines. And a lot of times people find out they're just not eligible because they may make too much money or don't qualify for Medicaid. So hopefully that explains it. I hope I gave you.
What is the difference then between Medicare and Medicaid?
Yeah, so again, Medicaid, it's administered through the states, but it's funded by federal dollars. Okay, and so you have, based on a person's income, if their income level is at a certain point or low enough, then the Medicaid dollars will help pay for an insurance plan that will cover a person's needs at usually a low or no out-of-pocket cost to the member or the participant. Medicare is federal, and that was the program that was created in 1965 during the Johnson administration. The money for that is out of a trust, and it is basically designed to help persons who are age 65 or older to be able to afford and pay for their medical services. You hit retirement age, you're not making the kind of money you used to, right? So as I was doing my studying on this, the Medicare was you think the Affordable Care Act was a big fight, and from what I understand,
that was,
Medicare
yes.
was even bigger. Yeah. So, but yeah, you had hospitals and doctors worried that they were giving away a lot of free services to people who just didn't have the money to pay for them, and so that was one of the reasons why Medicare was created. But you can also qualify for Medicare at a younger age. Generally at age 65 is when you qualify, but if you're someone who's got Lou Gehrig's disease, ALS, end-stage renal disease, or you've been disabled because you got hurt on the job or something, you can qualify for Medicare sooner. You do have to go through a process to determine and make sure that you are truly disabled. And if you do qualify, usually there's a 2-year waiting period. Depending on the severity of the disability that you're dealing with. People with kidney failure and ALS are likely going to qualify a lot sooner because it is a life and death situation at that point. But yeah, that's generally how Medicare works. Those are the differences.
What are the basic differences between a single policy for a single person and a family policy? Is there a lot of different hocus pocus in between?
Not really. Other than the number of people that are covered on the plan. So a single policy would be just for like covering me or covering you. And then family policies, when you cover more people, like a spouse, children, you would pay, obviously higher premiums to cover those individuals. And again, depending on the plan and its design, that'll tell you roughly how much it will cost to do that. But that's the simple version of explaining that. Yeah. It's just the number of people you're covering. Mm-hmm.
How would you go about if you are new to looking at insurance for the first time? What's your advice, and how should they look and study to get the right policy? What would be the first step for them to do?
Well, I think it depends on their situation. So a lot of people get coverage through their job, right? So employers might make it a little easier for you because they may only have like 2 or 3 options. Your portion of the premiums, depending on if you're covering yourself or you're covering family, you're probably going to pay about 25% of the cost of the premiums. And then after that, it's just a matter of determining, hey, do I have family members who go to the doctor a lot or not? That'll kind of determine the type of policy you get. For individuals, those folks who don't have coverage through work, it does get a little more challenging, and that's where the Affordable Care Act comes in. So here in Washington State, we have what's called the Washington Health Plan Finder. So they do have a link on their website that you can actually get quotes. You basically enter, without entering names, you can enter the dates of birth of yourself or the other family members that you may want to cover, and then your location where you live, and then you will enter like what your monthly income is, and then it will basically give you a list, depending on what you're looking for, between like 30 and 50 different plan options. And the way that they set that up is that they will have 3 different levels of coverage. If you're looking for like a catastrophic level, meaning that you're probably not going to go to the doctor very much, but you want to make sure that you have something in case something bad happens, or like a catastrophic level of coverage. That level means that you might pay a little bit less in premium, but when you actually need it, you're probably going to pay more for the medical services that you get. And they usually have high deductibles. The middle level plans are what's called silver. Those are kind of a nice balance between the catastrophic and the more comprehensive plans. So you'll pay maybe a little bit more in premium, but not nearly as much as you would at a catastrophic level. And then there's gold, and that's where you're paying high premiums up front, but you have lower out-of-pocket cost when you actually use the plan. So those plans may have deductibles somewhere around the neighborhood of like, $1,000 to $1,900, and then depending on how many people you're covering, they'll have the out-of-pocket maxes somewhere like around $7,000, meaning that once you hit your deductible, then the plan will cover 60, 80, 90% of the cost, and then you pay the 10, and then that 10% you keep paying till you hit your out-of-pocket max. And then once you hit your out-of-pocket max, if you're, having that much medical need for medical care, then the plans usually cover everything 100% above that for the rest of the year. Everything resets the following year, so you'll start at 0 and then start over. In Medicare world, everything is individual, so there's really no family level coverage in Medicare world. We all have our own Medicare ID numbers, and because of that, a married couple may have completely different healthcare needs. One might require, I just need to see my primary and maybe a specialist maybe 2-3 times a year. Others may need plans that are that actually cover more and may cost a little more because they may be dealing with a pretty serious health condition. So that's what I do when I sit down with people, is we take an inventory of where they are, what their incomes are, what their needs are, what their lifestyle is like, and we can basically minimize everything down to maybe like 3, 4, 5 different plan options depending on what we're looking for.
So how do we get a hold of you, Tony?
Well, very simply, you can find the Medicare Exchange and just ask for my name. My phone number is 253-226-7336. I have an email address, talbert@asb.insure. So we don't do .coms or .orgs, we do .insure. But I can get that to you. But yeah, I'm happy to answer anybody's questions if they have any needs, and also willing to set time with people and help them figure out what's the best way. Right now, one of the things that we're doing at the brokerage is we're kind of changing not our focus, not so much that we're getting away from working with people on their medical, but in the future, they're talking about money for Medicare running out by 2033, right about the time when I'm eligible for it. So, we're trying to get people to think more about protecting their finances and whatnot, so they don't go broke if they do have a major medical issue. So, but we're happy to help with that. I'm happy to answer any questions and set up appointments with people. Happy to do that.
You have needs for medical insurance. You got to protect your family. Listen to me very carefully. The best thing you can do is get an insurance agent that becomes a focal point on your needs for medical insurance, with a man who knows what he's doing, with a gentleman that will sit down with you with no pressure, no fancy cars driving into your driveway, no of that hocus pocus stuff that you see on television or on social media. My suggestion is, and I am insured with this great program that Tony has fitted me into. He took a lot of time to sit down with me, talk with me, go through different problems that I'm having with health, and fitted me with a plan that works for me. If you need medical insurance, think of this. It's very important to get the right agent to make sure that you're taken care of the right way with good medical health insurance. Let me give you that number one more time now. 253-226-7336. Call my good friend, Tony, and set an appointment today. Well, thanks so much for stopping by. We will be back on the air with Tony again in the future, and many other special guests, as once again we go out and destroy the thoughts that everybody has when it comes to the disruptors. We can destroy and upset you with no effort at all. A good friend of mine told me one time, he said, you keep bringing these special guests in, from hospitals, from insurance companies, from all these different facets of life. And it's always interesting to hear what you've got to say. So come on, enjoy what you're hearing today. If it's a situation where we can help you also by having one of our podcast interviews or podcasters give you a call and see if they can help you with your needs, it's simple. Just call us at 253. That's 754-8315, or get a hold of us on our email address. That's the Disruptors, TER24@gmail.com. Until next time, have a great weekend.
Looking for a perfect tee that feels good, fits right, and shows off your style? Check out Fat Cat Vinyl Creations on Facebook, where every shirt tells a story. From bold prints or one-of-a-kind designs, we've got something for everyone. Whether you're gearing up for game day, repping your business, or creating a gift that stands out, our team will help you bring your ideas to life. So don't wait. Check out Fat Cat Vinyl Creations on Facebook.